The vision seems simple. Emergency medical services of the future will be community-based health management that is fully integrated with the overall healthcare system. It will provide community health and result in more appropriate use of acute healthcare resources. These words are from a landmark document, the EMS Agenda of the Future, and it was written in 1996. The future has finally arrived.
Paramedics from North Memorial will soon begin a groundbreaking program that could take some stress off the healthcare system.
It's called Community Paramedicine.
Around the globe, a new healthcare provider has emerged, the community paramedic. The concept of community paramedics is all about using the skills of highly trained and experienced paramedics in support of primary care and chronic disease management.
A seasoned paramedic who's done their work for an extended period of time. They are within the community, they know what the resource needs are in the community relative to access to health care in particular, and they're ready to step up to the plate and provide this additional component of health care as part of a medical home. And they function actually under the licensure of a primary care physician. They're the eyes, the ears, the hands of this physician as they do their work within the communities, and they become a very important member of that medical team to handle the population's healthcare needs.
The story of community paramedics is closely linked to that of the North Central EMS Co-op. In 1997, the co-op was born literally around the kitchen table of Mayo Clinic's Gary Wingrove in Minnesota.
The Institute has been a leader in the international community paramedicine movement. We're one of the original conveners of the International Roundtable on Community Paramedicine and have been its major sponsor since 2005. We have also developed a community paramedic curriculum, which we provide free of charge to any accredited college or university in the world, and have provided it to over 125 colleges in 6 countries.
In all of our communities, there's a component of emergency medical services that is there, available 24/7 for 911 response. The beauty, however, of incorporating the community paramedic concept into the work of the EMS providers within the community is when they're not doing 911 response, when they have some downtime, they can actually go out into the community and assist with patient care, doing house calls, safety assessments, and so on, especially for patients who are vulnerable, who have no other means of getting in for health care outside of being evaluated in their homes in particular.
As a community paramedic, I think it would be really helpful for us to go out and use our skills as, just even as far as moving and moving around in the house and what's easy and what's not easy. We're pretty much experts in that area. And so getting people to realize what could be hazardous and could be a dangerous situation and helping them restructure the way they, do their life.
So helping with diabetes, helping with mental health and keeping them on track. Senior citizens that have a hard time keeping track of all their medications, keeping them online with that. And then again with the culture, just getting them directed to the right areas where they need, maybe getting them associated with providers that understand their cultural background.
When the program first started, I was a little skeptical, as if this would be able to take hold in EMS. And after being in it for over the last year, I can truly say that I believe this is the future of EMS. We live in a country now where healthcare is at a shortage. And even where it's not, people are in the homes, they need help. And who better to do that than paramedics? We're in the home already, they trust us. And so for me, it's the next logical step to place paramedics in the home in these non-emergent situations to assist the doctors.
You have an increasing number of elderly that have a difficult time getting around, accessing health care because of that. You have a large number of folks from third world countries, immigrants who don't know how to access health care to start with. You have a certain number of folks who are disabled for other reasons. They may have other health care issues and so on that prevent them from accessing health care. You have a large number of individuals who have behavioral health issues, and it's a very difficult thing for them to find resources to handle their problem. And you put all of those folks together, and it would seem to me that the community paramedic could fulfill some of the healthcare needs of those individuals in particular.
These new practitioners are filling gaps in the healthcare system, helping to achieve triple aim, but most importantly, impacting the lives of the patients in a very meaningful way.